Before taking your patient's blood pressure, make sure they have refrained from any caffeine and nicotine for at least 30 minutes prior to any testing. Patients should be seated quietly for at least 5 minutes prior to blood pressure testing. Make sure patient has both feet flat on the floor with back flat up against the chair. Make sure measurements are taken on the left arm with the arm supported at heart level. Blood pressure cuff should always be the appropriate cuff size to ensure accurate measurement. The bladder within the cuff should encircle at least 80% of the upper arm. Feel for the brachial artery. Wrap cuff firmly around the bare upper arm at heart level, making sure no clothing interferes with testing. Rolling t-shirt up, aligning the cuff with the brachial artery. You should be able to place 2 fingers underneath the blood pressure cuff to check for proper cuff size. Make sure you properly place the stethoscope prongs into your ears with prongs facing forward. The diaphragm of the stethoscope should be placed below the antecubital space over the brachial artery. With the blood pressure cuff we are using today, make sure the lever is not down as you pump the bulb up to 200 millimeters of mercury. You then slowly press down on the lever, which serves as the valve, at a slow equal rate of 2 to 5 millimeters of mercury per second. You will then hear the first thump, which is blood being rushed back into normal blood flow. This is known as the first Korsakoff sound, used to determine the systolic measurement. The diastolic blood pressure value will be the last sound you hear before the disappearance of the last Korsakoff sound. My patient's blood pressure was 96/60. She is classified as a person with a normal blood pressure. Before taking a second measurement, make sure patient has rested for at least 1 minute.